We will talk about tuberculosis. Tuberculosis is one of the most deadliest disease ever. It is bacterial infection. It is well known for its long-lasting and prolonged symptoms, and it causes severe damage of lungs. Primarily it affects lungs, but possible to affect other parts of the bodies, for example kidneys. Tuberculosis is caused by bacteria, which is called Mycobacterium tuberculosis, and it can affect any person, and it's widely spread disease. It affects around 5% of world population. Prevalence is higher in developing countries and lower in developed countries. Tuberculosis is spread by inhalation of tiny droplets, which is called aerosol, and this aerosol is contaminated by this bacteria. But fortunately, it's not very easily spread disease. Prolonged exposure is must in most cases. For example, if you have causal relationship to person and you just speak to the person, there is very low risk of getting tuberculosis. But if your family member is infected with tuberculosis, there is very high risk that you will get tuberculosis also. So tuberculosis infectivity is around 5%. It's depend on many factors like inflammation of lungs and bacterial spread in the lungs, and if environment is closed and poorly ventilated. So different factors are very important in this case. What are the symptoms of tuberculosis? First and most common and most important symptom is cough, persistent cough which lasts more than 3 weeks. So if coughing is last more than 3 weeks, it does not matter either it's dry or wet cough, both are possible. Maybe it colored red or pinky, it can be tuberculosis. Especially when there is night cough or early morning cough, and this cough is consistent. It's important because sometimes after common cold or after flu, cough lasts, for example, sometimes even 6 weeks, but it's not because of tuberculosis. But in case of tuberculosis, this cough is persistent. It lasts usually for several months. Second most common symptom is unintentional weight loss. It's very important, and person is pale due to anemia. You can see the classical appearance of a tuberculosis patient. He's pale and he's weak because of wasting of muscles, because of weight loss also, and enlargement of lymph nodes are also possible and common, and these lymph nodes can be painful or painless. Sometimes they are painful, sometimes painless, and lymph node enlargement are on the neck, in the armpits, in the groin, so different areas of body. For example, during common cold or during flu or during allergy, there can be enlarged lymph nodes around neck. That's possible. But when there is enlargement of lymph nodes in the armpits, in the groin, in the neck, and they are painful, and there is no other important disorders like, for example, lymphoma or other autoimmune disease, for example, lupus or rheumatoid arthritis, this enlargement of lymph nodes usually because of infection and because of tuberculosis. Third most common symptom is night sweats. Person experiences night sweats is common symptom also, and fourth important symptom is low-grade fever, persistent fever, low-grade fever that can be last more than 1 year, for example, more than several months, sometimes for several years also. So persistent fever, low-grade fever is important. Tuberculosis can be active or latent. What it means? These symptoms, we said that persistent cough, unintentional weight loss, anemia, enlargement of lymph nodes, night sweats, and low-grade fever, they are symptoms and signs of active tuberculosis. Active tuberculosis means when we have symptoms. In this case, bacteria are multiplying in the lungs. It's active tuberculosis. And we have second form of tuberculosis, which is called latent form. Latent form means that person has no symptoms and bacteria are not multiplying. And if person has latent form of tuberculosis, he is not contagious. He or she will not spread this disease. Latent tuberculosis is not problem at all. It has some risk, of course, and this risk is around 5%. If person has latent tuberculosis, there is 5% risk that it becomes active at some point of their life, especially after short period of time of infection or when person has weakened immune system, for example, during diabetes or during HIV infection, for example. There is risk, of course, but till the tuberculosis is latent, there is no serious problem. It's not contagious. It's not problem. Active tuberculosis spreads. Active tuberculosis is contagious. That's why active tuberculosis requires treatment as soon as possible. How can we say that after treatment person is contagious or not already? Usually, if treatment is effective, around after 2 weeks person is not contagious anymore. But to confirm that person is not contagious, we should culture the sputum, and if in the sputum no bacteria, it means that this person is not contagious anymore. And second important, if person has no symptoms, there is high probability that this person is not contagious anymore. What is diagnosis? First test is made is Mantoux tuberculin test. It is initial diagnostic method, initial test. Second test usually used is interferon-gamma release assay. They measure antibodies against an immune system activity against tuberculosis, and chest X-ray is also important test to assess lung condition and lung involvement in tuberculosis. What is definitive diagnosis and gold standard of diagnosis? It's Mycobacterium tuberculosis culture from sputum samples. It means that we get sample from our phlegm, from our sputum, and we see mycobacteria under microscope. That's definitive diagnosis. What is treatment? Treatment is intense. Treatment requires combination of drugs. There is standard multi-drug regimen, which means 4 antibiotics such as isoniazid, rifampicin, pyrazinamide, and ethanbutanol. We have these 4 first-line treatment. Isoniazid and rifampicin used for prolonged period of time, around 6 months, and first 2 months these 4 drugs. Success rate is around 85%. Some cases around 3 3% of cases, person can have multi-drug resistant tuberculosis. It means that this tuberculosis is resistant to this treatment, and this treatment is not effective. So you're treating this 4 antibiotics, 4 strong antibiotics, but you have no effect. Such cases are around 3%. And if person has tuberculosis, you treat, and after some period of time tuberculosis returns, there is 20% chance that it's resistant tuberculosis. So resistant tuberculosis is important problem, because treating is very difficult, because treating requires 24 months with strong antibiotics which are toxic for our liver, and it's problem, and success rate is only 56%. That's why even in modern medicine we have death from tuberculosis, because we have low success rate during resistant tuberculosis. It's very important. How we define if this tuberculosis is resistant to treatment or not? There is gene expert test, which means we checking genetic mutation of bacteria if it is resistant to treatment. It is a gold standard approach to define if this bacteria and this infection is resistant to this treatment. Another method is culture bacteria, but to grow this culture requires several weeks, so it's not practical. And about vaccination, we have vaccine for tuberculosis, but what is main problem? Effectiveness of vaccination is not very high. It's around 50% in adults. So if you get vaccine, there is 50% chance that you will be protected from bacteria, from infection of tuberculosis lung form. It's more effective to protect you from meningitis, and it protects effectively kids from meningitis, but it does not protect effectively on lung infections. So we have low protection number. Of course, it's not very low, 50% chance is still good, but vaccination is not considered very effective. That's why it's not very widespread, but risk groups should be vaccinated. Vaccinate wanes over 10 years, around 10 years, sometimes 15 years, so it's effective around 10 years. And there's important question that how can we say when after vaccination, after what period of time we are protected already from infection? After several weeks, around 6 weeks, person already protected at some degree, but full effect of vaccination requires around 1 year. Small risk. What is the risk of vaccine effectiveness and vaccine safety risks? This is very small risk of spreading infection in immunocompromised patients. This risk is not in healthy persons, generally healthy persons. So, and even in immunocompromised persons, these risks are rare and very low. That's all I wanted to say about tuberculosis. Thank you for your interest. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.